Hi folks, this is Dr. Dan at Stonebridge Animal Hospital. This is Rachel, one of my assistants here, and we're going to give a basic exam to Rocky here. Rocky likes exams, don't you, Rocky? No, I don't know. Oh, you'll go puppy, don't you? Huh? All right, very good. When we first start out with examining the head, we want to make sure his eyes are okay. Rocky's got a little problems with his eyes, and we're going to have to get some medication for him because they're a little cloudy in their little aspect. He's lost some of his sight. He is about 10 years old, and he doesn't see it real well. Got a little crusty on the nose here. We're going to have to scrape that off and clean that off, and have the owner probably take a little better care of that, and also clean this wrinkle out. Puggies are very, very important, and a lot of dogs that are short-nosed dogs need to be cleaned out. Hydrogen peroxide on the paper and a towel works very good. Don't need to buy those expensive things, those expensive wipes from the store or anything. Just take a paper towel and hydrogen peroxide and clean those areas off. Even around the eyes, that's a good thing. Now, I'm not saying to put peroxide in the eyes, but it's very, very important to clean over the outside. If you would happen to get peroxide in the eyes, it would not hurt a thing. So don't get scared that you're going to do that or anything like that. It's much better than water, because if you use water to clean around the eyes, it will just run off the infection. If there was an infection, there isn't here really, it would run off the infection back in the eye and carry more infection in an area. And of course, we look inside of his mouth, we glance at his teeth, and he is needing a little bit of a dental here. They're not really super bad, but these gums are a little infected and irritated, and obviously he's had a few teeth extracted before and had this problem before. So it's very important we look at it, and we open up his mouth and we look down his throat. They don't always like that, like Rocky doesn't, but we want to make sure that his tonsils look okay in his tongue and there's no lumps or bumps inside of his mouth. We also look in his ears, and the most important thing, not only looking at the ears, but smelling the ears, and that's something I teach my clients too. Because the nose can almost be as good as an otoscope, looking down through there in the thing, because you can at least determine it even. So I have all my clients, if they will, and they don't mind it, I smell the ear, and then smell the body, and it should smell pretty well the same. And that it's important. But if it doesn't, or they're itching their ears or any other symptom, then it's very important for you to get them in here and we treat them, and then we start making care of the problem. But that's one basic thing that my clients enjoy, the aspect of being able to check and not worry about it and know that, because I want all my clients to have good knowledge about taking care of their dogs and cats. Rocky here also, I'm going to turn him right around here. I have my client, or my assistant, we scratch behind the ears. Even when we're giving vaccinations, we basically scratch behind the ears. That makes them hold still, because if they hold still, I can get the needle in very easily without hurting at all, and they never flinch, never scream, and never yell. So it's very, very important. We do a lot of ear scratching here. We check their lungs and their heart. And with all pugs, they do a little grunting and groaning and things like that. And you got to discern the difference between the grunting and groaning and the heartbeat. His heart sounds pretty good, but we do know from the EKG he has just a little bit of a problem. We did that earlier. His lungs are nice and clear, nice and clear. Then we pick him up and we kind of do that. She's going to do that. We check his back legs, make sure the patellars are okay, and also the things and all the digits and all the nails. So it's very important to feel him all over for lumps or bumps or anything, because a lot of dogs get kinds of lumps on there that can be cancer in some form. All lumps and bumps, as far as I'm concerned, should be taken off and sent in for biopsy. When I was a neophyte and just out of school, sometimes I'd look at a lump and I'd say, let's see what happens. But that backfired on me a lot of times. So anymore for the last 25 or 30 years, any lump or bump should be taken off and sent in for biopsy. A lot of times in an older dog, we don't have to put them under anesthesia. All we do is give them a little tranquilizer. Then we do a local, like pulling a tooth, like a dentist does pulling a tooth. Local, and then we excise it and take it off and send it in for biopsy. So that can be happening a lot. So Rocky's looking pretty good here, except for his eyes, and he's wrinkled here and needs a little attention with his ears. And but he's doing pretty good overall, considering his age and everything like that. And so anyway, we'll get Rocky all fixed up here and he'll be just fine.